our own health by our own self. You know, sometimes we have help from people who should know better, but it is what it is. The WHO saw that this was a growing problem, and that is why a week was dedicated to spreading awareness on antimicrobial resistance. It ended yesterday, started on Friday last week and ended yesterday. World Antimicrobial Awareness Week is what it was called. Wow. It's a global campaign that is celebrated annually to improve awareness and understanding of antimicrobial resistance and encourage best practices among the public, health stakeholders, and policymakers who are all active in playing a crucial role in reducing the further emergence and spread of antimicrobial resistance. This year, the theme is preventing antimicrobial resistance together. I like this theme because it's saying everybody should put their hands together, come together, put your heads together to prevent this. And to talk to us today about our topic is Dr. Nwadinigwe Emeka, the Chief Medical Officer of Zenith Medical and Kidney Center, Lagos. When we come back from this break, we're going to dive in head first to talk about this, because this is a menace in our society, in Nigeria at large. I am Lillian Abirikan. This is Mainland 98.3 FM. Don't touch that dial.
When the airwaves in your market become more and more crowded, it's time to break it open and really stand out. Broken Air is here.
On Mainland 98.3 FM, the sound of Lagos. Lagos.
Welcome back to Health Plus on 98.3 Mainland FM, the sound of Lagos. Okay, so I've told you about what our topic is, but I'll still say it again. Antimicrobial resistance. That is the topic for today. And I added antibiotics to the topic because that's what people know it as, right? Antibiotics. And I told you that I have a guest with me to talk about this. Nwadinigwe Emeka. Am I pronouncing your name well?
Yes, very good.
All right. He's the Chief Medical Officer of Zenith Medical and Kidney Center, Lagos. Before we go further, I just want to remind you listening to us that we are live on YouTube and Facebook at 98.3 Mainland FM. Or Mainland 98.3 FM. Just search us and you see live. Click on it to watch what's happening right here in the studio. My name is Lillian, and with Emeka, Dr. Emeka, will be discussing this. Before we go any further, I think it's imperative for us to know what antimicrobials are, because it sounds like a foreign thing, but I think it should be domesticated, right?
Yes.
What is it?
All right. I'm glad to be here. All right, so antimicrobials just means things we use to tackle microbes. Microbes just includes bacteria, viruses, fungi, some parasites. So these are some of the medications that we use to tackle some of these microbes in both humans, plants, and animals. That's just what it is. Antimicrobial therapy.
What do they include?
Okay, so
something that we know. Don't call name brands.
Okay.
Just call like.
All right. So you have antibiotics. We're going to basically be discussing antibiotics because that is one thing everyone knows. So let's use, instead of using antimicrobial, let's just use antibiotics.
Before we just zero to using antibiotics, when I was going through this, I talked about some other names like. Those that we use, and you said antifungals.
Yes, there are antifungals, there are antivirals, there are antiparasites. Just anything we use to tackle any of these organisms that will come and cause wahala.
So before we zero ourselves to antibiotic, which is one that we use more. When one has an injury, parents will just say, "I put this thing on it." You know what I'm talking about? This tubed antifungal, antibacterial. So you're saying that we can abuse that too?
There's no medication that you can't abuse. The definition of abuse is using a medication without it being prescribed.
Okay.
That's basically what it is. And even paracetamol can be abused. You understand? So it is best to for any medication you want to use, that you have someone who is qualified, a medical doctor, prescribing it. Do you understand?
Okay, now let's talk about antibiotics.
All right. So, what is antibiotics basically? It's what we use to tackle bacteria. Bacteria is one everyone knows. Not everything is caused by bacteria, but bacteria is one of the most common microbes that causes problems. Do you understand? You have you have virals, you have viruses, you have fungi as well, but bacteria is one everyone knows. And antibiotics, the medications that are available everywhere. You see them in chemists. There are people who carry it on their head. You see it in pharmacies
on the streets. Like someone who just set up shop on the sweet side and selling medicines.
It's crazy because it's okay. Before we go ahead, most of what we are going to discuss today, we might not be able to touch everything, really, but I would try my best to touch on salient points. So before we dive in head first, I want you to know that in a good number of countries where a good number of developed countries, it is easier for you to get hard drugs on the streets than for you to get antibiotics.
Wow, really?
Yes. There have been talks like that in countries that in the UK, in the US, not in the US, but I'm not sure in the US, but in the UK, in Canada, all these countries that are all over
countries.
It's not me that will say that one. No.
They're functional, aren't they?
Well, but it is easier. So I'm familiar with, you have to have two top specialists signing off on prescription for antibiotics.
Wow.
So I'm not sure if Augmentin is a brand name, but I know it's a generic name. I know we use it. So for you can easily go on the street and get Augmentin. Everyone knows Augmentin. You understand? But for you to get, you can go. If you step outside, you don't even need to walk too far. You pick up Augmentin. You probably know the cost of Augmentin. But if you stay in the UK, you can't easily get Augmentin. It's one of the most. It's very difficult to get Augmentin.
To get antibiotics.
Exactly. I'm just using so that everyone will know what antibiotics, what we're talking about here. So it's important. This conversation is very important because by the time we go on, we understand how much damage has been done. I will give you more information about it.
So I want to talk about what they treat. The function of this antimicrobials in the body, right?
Yes.
We're talking about antibiotics, for instance. What can one have that they want to use antibiotics for?
That's a very good question. So
I'm not saying what is right though.
Do you want me to say what people do? Yes. Okay. There are a lot of things that people do that are just wrong, basically. I've noted the one of the most, if I may say this, ridiculous things is when people take antibiotics when they have had unprotected sex. That's one of the most ridiculous things. You hear someone say, I use that medication to just wash it out. I'm like, what?
Yeah, I've heard about that before. These babies is a bacteria.
I'm like, why are you doing this? And you have people who they have tummy upsets. They just have some mild tummy pain. Next thing, they are popping antibiotics. Some people have headache. They say, I have malaria. Pop antibiotics. Add antibiotics to your anti-malaria. Some people have you have leg pain, or maybe you have a swelling somewhere. Oh, it looks like bacteria. Pop antibiotics.
What of UTIs and STDs? Okay,
so you have UTIs, you have STDs. These are all of these. I'm not saying all of these concerns are not recognized, but it's the fact that you do not know what to do, but you don't care to find out what to do. Because I had someone who sent me a message recently. She wasn't good, but she messaged me and she was like, "Oh, I've been having this, and this." I was like, "Oh, okay. Most likely." I told her, "Do this test." She did the test, brought the results, sent the result to me. I reviewed the results, and I told her, "Oh, most likely you have a UTI. take this medication for 5 days. I gave her the medication to take for 5 days. For 3 days.
That is a prescription.
That is a prescription, because I am licensed to do that.
And you have checked the results.
Do you understand? And I checked. I didn't just give her prescription based on.
How is it doing you?
Do you
Which side? When did this start?
Exactly. So I had her do tests.
Yeah.
It could be burdensome. People don't enjoy coming to me because I will make you do tests.
It's important.
It's important because.
But then see, I know that we're still talking about what they use to treat, but since you're talking about tests, you go to scan diagnostic center. Yes, I'm not, because I have been there.
All right, let's hear it.
Last year I was not feeling so well,
okay,
and I went for a scan. They told me to go to do tests. I went to a diagnostic center. What is the issue? What did they say? Malaria and typhoid plus. But then the doctor that frequents this show told me that I don't have malaria and typhoid plus. I should go and take another test at this and this center. Now that center I went to take this test at is a recognized center. Go FDA, right? Approved. Everything approved. But they don't have the capacity or whatever it is to give me exactly what is wrong with me. I have a friend that had leukemia for years. Whenever he went to test, they were telling me he had malaria and typhoid. This guy's stomach was bloating. He was weak every time until when he found that it was already too late, and he eventually died from it. That is something I have had in my head for a long time. Like, this is crazy. So, what do you think about this? And how do you think that can be tackled? Because I know we digress, but we're going to double back.
All right. So, first and foremost, I'm really sorry about your friend.
Thank you.
That must have been a painful loss for you. I'm sorry about that. So, thanks. I on my WhatsApp status, I said I was going to shatter some tables, and this is one of the tables I'm going to shatter. I will make it clear to you, everyone who is listening to me right now. If you go to a facility, any facility, no matter which facility you go to, and they ask you to run a typhoid test, and they take your blood sample to run that typhoid test, they are taking your money they are taking you for fee, idiots. They are scamming you. It's either the doctor doesn't know what he's doing, or he's intentionally just taking your money. The only way to diagnose the approved way to diagnose typhoid. First and foremost, typhoid is not common in Nigeria. Just that everyone should know this.
It isn't?
It isn't common in Nigeria. It's commoner in India and all these other countries in that region, Asian countries. But it's not common. India, Thailand, all these countries. But in Nigeria, it isn't so common. It is very rare.
It's misdiagnosed. Is that what you're saying?
It isn't misdiagnosed. It is poorly diagnosed. Do you understand? It is poorly diagnosed. I've had only one person come to me to tell me that, I've had only one, and I have a number of medical doctors as friends. Do you understand? So I've had only one friend of mine come to me and say, yes, I confirmed typhoid in this patient by doing what is called a stool MCS, stool microscopic culture and sensitivity. So they will take the stool sample and look at it under the microscope to look at the typhoid organism, Salmonella typhi. Do you understand? Sorry, is this Salmonella typhi? No, typhi something. No.
Typhi something.
Yeah, shout out this typhoid. I'm sorry, I can't get the basic name. But they'll look at it under the microscope to confirm that you have it. Then they'll give you medication. So I don't know where all of that I don't know, because I'm not very old, so I don't know where all of that whole nonsense started from, with malaria coming with typhoid, because it is not correct. That is not correct. You understand? Malaria and typhoid are not brothers. They are not siblings. They are not cousins.
And typhoid, like
no, it
one and two.
It doesn't work good, and that is where the antibiotic that's where the antibiotic abuse comes from. Because any patient that has malaria, they just assume that the patient has typhoid, or they run what is called wide-out test. Now you see,
wide-out, yes.
Any facility that forces you or makes you run a wide-out test, or tells you to run a wide-out test, they don't know what they are doing. I can tell you for a fact that they don't know what they're doing.
It's an outdated test.
It is an outdated test. It is no longer used. It isn't even. So the wide-out test is not sensitive. It's not specific to typhoid. Do you understand? So it's not even sensitive. Do you understand? It's not even sensitive to typhoid. There are parameters we use to to detect infections and all of that. So that's what we use, sensitivity and specificity and all of that. It's not necessary. It's just know that you cannot use whiteout tests to detect typhoid anymore. So if they make you run a typhoid test, or they tell you that, oh, you have malaria and typhoid, it is, so you had that your friend, yeah. So I'm going to tell you something that happened recently. This happened like last month or 2 months ago. Let's say last month. I had this neighbor of mine, yeah. He wanted to use me to check babe as per my personal doctor, speak to my personal doctor, you know. And I was like, yes, no wahala now. Yeah, you be my guy. And then so he calls his babe and tells me that, oh, the babe is in a hospital and they've been managing her for the past 2 weeks. And I said, what are they managing her for? He said, he doesn't know. I should talk to her. And I called the girl, and then he called the girl, and then I was talking to her. I said, hi, this is Dr. Emeka. I'm this guy's personal doctor. You know, I'd like to know what's going on. She said, yeah, I've been in hospital, this and this and this. I was like, can I speak to the doctor in charge? And then after a while, I said, doctor is not on ground. One thing, say he stepped out. I was like, okay, no wahala. That's fine. When she comes back, please call me. Then she called me later, and I was speaking to the doctor. First, doctor was rude. That's unnecessary. Although, yes, I don't like it when another doctor is querying me, but I want to
you need information.
Yes, exactly. I told doctor that the girl is I am her brother. Do you understand? So I could get more information. But
that doesn't require rudeness, does it?
It doesn't require rudeness. I told the woman that I was a doctor. Do you understand? I told her I'm a doctor, and I just want to know what you're managing my sister for. It isn't
straightforward.
Do you understand? It isn't. It's not irrational. Do you understand? And then she goes and she's like, "I'm managing her for malaria and typhoid," and I'm like, "And you've managed her for malaria and typhoid for the past 2 weeks?" She said, "Yes." She was very rude,
and she was like hospitalized.
Yes, she has been in the hospital for the past 2 weeks. I just dropped the phone and I looked at my guy and told him, "Guy, you better get that girl out of there. They will kill her there." That's what I told him. You better get that girl out of there. If not, she will die there. I don't know. I didn't bother to, because I got a lot busy. I think talking about this now would actually send him a message to find out about her. So you're talking about how you're saying that misdiagnosis of certain illnesses can, or you said wrong diagnosis actually can increase antibiotics use. And then the resistance. So what happens? I would like a mental picture of what happens to the body or organisms in the body when antimicrobials are misused. All right, we are zoning down to the antibiotics now. Let us say, let us just assume.
1 second. By the way, if you have any questions, send it as an SMS or WhatsApp message to 09136000410. 09136000410. We're also live on Facebook and Instagram at 98.3 mainland FM, mainland 98.3 FM. It is House Plus on this dial. I'm Lillian and I'm here with Dr. Emeka. So I asked what happens to the body when antimicrobials, and we're zeroing down to antibiotics, are misused.
All right. Yeah. So let's assume. So I said that antibiotics tackle bacteria. Yeah. So we have bacteria. One. Let's assume. There are a lot of bacteria is the plural form of bacterium, so you just know that there are millions and millions when they attack you. Yeah, so they are like microscopic, so you can't see them. Obviously, there's probably bacteria in this room, but we don't know. Do you understand? We have bacteria 1, bacteria 2, bacteria 3, bacteria 4. Let's just assume.
Yeah.
Now, I will use one of the most common things that causes antibiotic resistance. Not finishing your antibiotics. So you've given you Augmentin. I would use Augmentin because Augmentin is a generic name.
Antibiotics.
I'll just use antibiotics. So they give you antibiotics. They've told you to take these antibiotics for 5 days. Do you understand? You're supposed to take in the morning and in the night for the next 5 days. Take a particular dosage for 5 days. So you've taken it for 3 days or 2 days, and you're feeling jiggy. You're feeling better. Let's say we are giving the antibiotics. That my friend I gave the antibiotics for the UTI. You understand? And I told her to take it for. Let's say I took it for 5 days, and then she took it day 1, day 2. She was feeling much better. She did the third day. She was feeling a lot better. Then she stopped taking it. Now what happens is, let's say there's bacteria 1, bacteria 2, bacteria 3, bacteria 4, bacteria 5. Now you've taken it for the first 3 days. Bacteria 1, bacteria 2, and bacteria 3. It has killed them. You understand? But you didn't finish the antibiotics.
So what happens is bacteria 4, maybe bacteria 4, it just barely killed it, just killed it small. You understand? But
weakened it.
Weakened it. But bacteria 5 is still strong. So what will happen is bacteria 5 will drag bacteria 4 home. They will go to one coral. Then they will go and begin to gym. They will go and begin to work out. And I'm narrowing. I'm
that is the best
it
way
as
to
much as
continue.
They will go and need to work out. They will go and eat protein. They will take protein shake. They will gym. They will go to gym. They will pump. And they get stronger. We call it mutation. They become resistant to that antibiotics that you used. Do you understand? When they now come back, you now think, oh, okay, I'm going to use the antibiotics again. Actually, Dr. Emeka told me to use the antibiotics to tackle it. What's there? I will destroy them. But you use the antibiotics and it doesn't work.
Yeah.
Do you understand? You now have to use a stronger antibiotics because that one I gave you doesn't work anymore. Because bacteria 4 and bacteria 5, they've gone to go and gym. What then happens is they will now tell their brothers that there's these antibiotics because they are so the science students in the house, they must have taught you in primary school and secondary school, Dr. Niger D. Cow. One of the core attributes of a living thing is adaptability. You should be able to adapt to your environment. It doesn't just apply to humans, it applies to any living thing available, and antibiotics included. Do you understand? So what's I said and bacteria included. So what they will do, after they've gone, they've gymmed, they've gotten stronger, and they've mutated. They will go and tell their brothers, there is a new antibiotics in town. You better get stronger, or there will be a problem. And what those ones do? They are not dumb, They too will go. They will go and walk out, and they will mutate. You understand? I put the mutate in, so you know the basic term. So when you now use that antibiotics that I gave you for that UTI again, or someone else, now let's use you now. I would tell you how bad it is. When you use the antibiotics that I gave you for that UTI, it won't work because it's no longer the same bacteria you're dealing with. They are now bad boys. They are now stronger boys.
Bad boys for life.
They are now stronger boys. They've gone to gym. So what you have to do is you have to now use a stronger antibiotics.
Okay.
But you forget the problem. You didn't remember that the problem that started it was that you didn't finish your antibiotics. Now, I told you that there's probably bacteria on this table. There's bacteria everywhere. You can't see them. There's on the door handle. There's on the toilet handle.
Everywhere.
It's everywhere, basically. So now that one way or the other, you sneeze into your hands, and then you now touch the toilet handle, and then that bacteria gets on the toilet handle. Me, and now go and touch that bacteria that has gymmed. Do you understand?
Yeah.
I now want to take the antibiotic. It will work. Do you understand?
Yeah.
So that is how it affects. Now, extrapolate this information from 2 people to the entire population of Nigeria. Do you understand? Do you see how bad it is?
And it started from one man.
It just started from one man. And this is not a problem that is starting today. Okay, so is this bad that when I was in medical school, there was this medication. It's a generic name. It's a very strong medication. It's called meropenem. It's a generic name. It's not.
Okay, it's not a brand name.
It's not a brand name. So it's a generic name. In medical school, I barely saw meropenem. Meropenem is one of the bad boys antibiotics. Like, it's a strong antibiotic and it's very expensive. One vial costs at least 30,000 naira at the moment. One vial, and we need to give you 3 vials for 3 vials. So it can be as bad as giving you 3 vials in a day for 2 days or more, depending on how much problem it is. So in medical school, I barely saw meropenem. It was only when someone came in with very, 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 very bad bacterial infection that they would bring out the bad boy meropenem. You understand? So, but now, most people. So the reason you've seen that this problem has progressed so poorly and so terribly that nowadays meropenem doesn't even work. Nowadays meropenem is our first. So there's something we call there's line of medication. So we first start from the smallest to the highest. You understand?
Yes.
So we start small, then we go up depending on how well you take treatment. So now most times we just start with meropenem because those small guys,
Are
they are no longer working. We are just wasting our time if we are starting. So we just go, oh, okay, this person has this. There's no point. You understand?
The effects of this antibiotics resistance or antibiotics misuse or antimicrobial resistance, can it be reversed? As the organisms of the bacteria have gone to gym, can you do anything to make them back to the original state?
So remember to answer this your question. Remember when I said that there have been talks that in developed countries it's easier to get hard drugs on the streets than to get antibiotics. The reason for this is because they know that once the problem once the problem starts, it cannot be reversed.
Okay.
So they don't want it to start at all.
Yeah.
That bacteria has already gone to gym. There's nothing you want to tell him again. You understand? We just have to hope that the scientists and the brilliant guys that do research and all of that, shout out to them, that do this research and get us new up-to-date antibiotics and all of that, they give us things that can tackle these guys. And that is why this education is important. So when they do give us new medication, we won't just waste it. Do you understand? We won't waste that opportunity.
All right. So what can be done to tackle this? By the way, you can send your messages or SMSs or call 091360000410 to ask any question you want to ask to the good doctor. What can be done to mitigate this issue? All
right. So I'm going to have to tell you about why the problem is in existence. Then I'll give you the solution. So let's do it one by one. I mentioned someone who doesn't finish antibiotics. Finish your antibiotics.
Okay.
Finish your antibiotics. That's the first thing. Secondly, do not abuse antibiotics.
Okay.
Do not take antibiotics that is not prescribed by a medical doctor. Remember I told you that in developed countries or in the UK, it takes like 2 specialists to sign off on you to take one small antibiotics that you most likely will get from Nigeria. And Nigerians are so mischievous that they buy antibiotics from Nigeria and carry it there.
Yes.
You understand?
Yes.
So you are even putting them at risk. So they allowing you into their house. It's like someone allowing you into their house and you are coming to, you want to set trap for the person because you would expose them to that that bacteria that has germed.
And they might not be well suited for that.
Do you understand?
Whew, okay.
You see how terrible it is now.
It is.
And you see how important this conversation is. Now, I mentioned finishing your antibiotics. First, don't take antibiotics that is not prescribed by a medical doctor. Because of questions. Then, if necessary, we'll ask you to do some investigations or some tests. You understand? Based on the test results, we will now give you
or give you a prescription for something else.
Give you a prescription. Although there are some times that we might not necessarily have to give you tests because the symptoms you are coming with, we already know, okay, this is most likely what is happening. So we give you what's called broad spectrum antibiotics. But even these broad spectrum antibiotics are no longer useful. They are no longer functional because they've been abused.
Hello, 60000410. Just round off your thoughts on that because we have some questions, and this was not even antibiotics related. But let's.
All right, so they've been abused because these broad spectrum. Remember when I said broad spectrum means that they can tackle a host of this. I don't want to go into the nitty gritty, the medical jargons, But broad spectrum means that they can tackle a host of problems.
Yes.
A host of bacterial problems, but if you abuse them, those bacteria, they will go and gym. They'll be stronger and you can't use them anymore.
All right, you're still listening to 98.3 Mainland FM, the sound of Lagos. Dr. He's giving us the tea, concerning medicine and how we should stop abusing meds. Okay, mothers, so now we they start them. How is it doing? When did it start? Okay, cool. Let me go and check. You open your medicine drawer and bring out something that was prescribed to you to give someone else. I was
going to talk about that. That Iya Emeka telling Auntie Ada that I use this doctor told me to use this medication.
And it works.
It worked for me.
It worked for you.
Can you use this medication? That's another way. Stop that. That's just wrong.
And you say this one is no longer working. take this one instead.
Exactly.
But that you don't have the same level of resistance. All right, good morning. I'm Emmanuel from Abulegba. I'm having issues, bringing my old man up. And when I went to Surulere to meet the doctor, he told me that he is going to give me a drug, and I told him I thought he would have carried the test before giving me drugs. And please, can I have your number, sir? So you understand what he's saying now? He went to somebody, told him that my old man is not coming up. And then he said, take this medicine. I said, are you not supposed to test me first?
Yeah. All right. So how do you want me to tackle this question? He had an issue with getting his old man up. That in itself, there are a number of things that cause that. I don't know how old he is. I don't know how old Emmanuel is.
You can send your age, please.
Yeah. So I don't know how old you are, but a number of things cause you not to be able to. It is what it's called erectile dysfunction. I don't know if I can say that.
Yeah, you can.
Yeah, so it's what it's called erectile dysfunction. But there are a number of things that can cause erectile dysfunction. Especially, I assume that Emmanuel is a young person that has been having issues. There are a number of things. So erectile dysfunction, what you need to do is to take a break.
Okay.
There are a number of things that can be causing the problem. Do you understand? Yes, that doctor should have. There's really no test to check for erectile dysfunction. There is a test to check for infertility.
Okay.
But not really erectile dysfunction.
Okay.
The doctor will most likely ask you a number of questions that would try to find out if there's some problem, maybe from your brain or from your hormones that's causing the problem. So if that isn't the case, I don't know. I can't really say. But if that isn't the case, what I will tell you is that stress is one of the major causes of erectile dysfunction. You need to relax, calm down, find a safe space, get a massage, chill.
Just calm down. Baby, calm down.
You understand? And most likely your old man would, do this.
I'm treated together with malaria. It could lead to the second phase or Duara malaria. I think that's a mistake. So that is just a comment, right? Salvation from Egbeda is saying he thought typhoid was an extension of malaria. Let's take this one. Hello?
Hello, good morning.
Good morning. Your name and location, please.
I'm Mr. Nwokota calling from Ikeja.
Okay. Give me your thoughts. What's the question?
In fact, not just a question, just a commendation. I want to thank the doctor for this timely information. The doctor was saying the way and manner our medics diagnose typhoid in Nigeria, that it cannot be that true. In fact, there was a time my younger sister called me from the village, because these scammers are more in the rural than in the township. She called me and told me she had malaria, typhoid, and hepatitis. I shouted, there's no way you can have these three and still have the strength to talk the way you are sounding. That is not true. She said that's what the doctor said. Please, if you can, maybe through the Nigerian Medical Association or whatever, pass this information so that people can know. A lot of people are dying because of taking too much antibiotics. Because anytime such a thing happens, they will go on their own to buy over the counter and be ingesting themselves or taking this medicine themselves. Thank you once again for your information. In fact, I so much appreciate what you did.
You have corroborated what my family doctor told me long ago about wrong diagnosis and scamming games going on in our country, especially in the rurals. My sister told me a healthcare giver diagnosed her of typhoid, malaria, and hepatitis. And I told her impossible. I think it's the same man that sent the same question. And he's saying thank you for this information. And we have a message that is not related to this. It said, is it true that there's a map? Are you listening? Is it true that there's a map that detects when to conceive and give birth to a male child, and also knowing your age as well? If it's not true, what can be done to conceive a male child?
Should I answer that, because it's not in tandem with what we are discussing?
Please do, if you can, if you have
all right. So I had a patient recently that asked me this question about conceiving a male child. She was really bothered because I think she had like 2 daughters, and so only God can determine the sex of the baby. Only God. God first. And for everyone listening to this, I want you to know that the woman is not in charge of determining the male child. This is God. God. The woman has what's called the XX chromosome. Only the woman has XX. But the man, what makes the man a man is the fact that he has the Y chromosome. He has the XY chromosome. And depending on how strong his Y chromosome is, that will determine if the sex of your baby would be a boy. Do you understand?
Yeah.
So it's only the man. So there is no map to determine when to give birth to a male child. There's no God that you want a male child. But I should say this also. Females are quite personal. Personally, I don't know. So it's all personal idiosyncrasies. I have told my fiance about this, that I'd prefer 2 girls. And that's just it, because
preferences.
Yeah, you understand?
And then not religion, tradition. If you have not given birth to a male child, you have not started. But then somebody said you are looking for male children, right? But what are you keeping for them? You are bringing them to the world. They're not giving them any inheritance or any trust fund.
Funny enough, it's Igbo people that suffer this thing.
Unfortunately,
because they don't practice. They don't practice protected sex. They don't believe in contraception because of the Catholic Church and all that. And
really,
yes, majority, a good number of Igbos are Catholics, and the Catholic Church doesn't approve of contraception.
Huh?
Yes. So what they do is they do withdrawal method, and they do what is called they select. I've forgotten the particular. Anywho, it is important for you to note that the more you take in pregnancy, the more what's it called? The more liability you're bringing in, because the more children you have, the more you have to take care of them, the more you have to work harder, you have to feed them, and it's a lot of stress,
So stop procreating, looking for a male child.
Exactly.
Give birth to the amount you can, the number that you can take care of.
God gives and God, determines.
Yeah. So you be the one to take care of them. So be careful. Don't be giving birth. I know people who have given birth like 7, 8 children, looking for one boy, and the boy come at the end. Now he's not the one suffering the suffer. All right. And before we go, let me take this message from Emmanuel, the man who sent a message concerning the inability to get his old man up. He said, I am 31 years and you're really the best. I don't rest and I work every day, sir. Honestly, you have restored my self-esteem, sir. So as you don't rest, try and get some rest.
I appreciate you, Emmanuel.
Yeah.
Thank you for that.
So this program comes your way every Friday, 10:15 a.m. All right. So next week we'll have another pressing issue that we'll talk about in the health-related matters, really. And there's no even time to talk about the myths that I wanted to debunk. Maybe some other time we'll do a part 2 on this. Thank you very much, Dr. Emeka, for joining us today. It was a pleasure. I didn't even know when the time.
I really appreciate you.
Ran. Okay, let's leave you with this one. Is by Rema Time and Affection. Up next, it is still on the matter with Temi Thames and Alexandra. You know what they do. They give you topical issues and you get to contribute. My name is Lillian and this is Health Loss on 98.3 Mainland FM, the sound of Lagos. Keep your dials locked.